Hello everyone. So today I've come up with a new series in my channel, which is one concept a day, where I'll be teaching one concept from pathology in depth so that you can tackle any questions that come from this topic in INI, NEET and in your UG. So the reason why I took granuloma as my first topic is because I was going through the recent INI recall and I found that there was one question regarding granuloma formation, and I thought since this topic has a lot more than just that one concept, so if we tackle this topic in depth, so you guys can answer any questions that come from this particular topic. And granuloma is an important topic for UGs, PGs, NEET and INI. So let's get started. So what is a granuloma? It is a type of chronic reaction, chronic inflammation, which is mostly because of activated macrophages, T lymphocytes, and with or without central necrosis. Right, so this is what makes a granuloma. So this picture that you see in behind this is again a granuloma. So I will show you how a granuloma looks on H&E, followed by, after finishing the topic, you can identify yourself. So when you see this image might look very new to you, but if you see carefully, you can see this right here is a collection of epithelioid cells, which are in turn known as activated macrophages. So these activated macrophages are known as epithelioid cells and their collection is known as granuloma. So a 40x view of this lesion is what we can see here. This is a granuloma. I know this might be difficult right now to identify histologically, but once we finish the topic, I'm definitely sure that everyone can identify this lesion right here. So coming to the topic proper. So like I said before, it is a type of chronic inflammation known as granulomatous inflammation. Here we see that the T lymphocytes get activated, and when they get activated, they cause macrophage activation. So these macrophage which are activated, when they gain increased amount of cytoplasm, they turn into epithelioid cells. So these epithelioid cells are the basis of formation of granuloma. So how do they look? They look slipper shaped like this, and then they have a nucleus with abundant amount of cytoplasm. So they have abundant cytoplasm. So these epithelioid cells, when they fuse together, multiple epithelioid cells fuse with each other, that is when we get a giant cell, which is again seen in a granuloma. So this is a multinucleated giant cell. So like the name suggests, it has many nucleus in a single cell. That is why it's known as multinucleated giant cell. And this has a particular name, which is known as Langerhans giant cells in tuberculosis. So coming to the next, pathogenesis. See, again, like I said, now can you identify the single cell here? This is a slipper shaped cell. Again, this is a slipper shaped cell. These are all collections of epithelioid histocytes. If you see here, this is a vague granuloma. This is not a proper granuloma, but here you can see multiple epithelioid histiocytes. So this is a 40x image of this one, zoomed out version. Again, so like I was telling about multinucleated giant cells, this is how multinucleated giant cells look in H&E. Can you see that there are multiple nucleus in a single cell? So I'll zoom in the image so that everyone can see. So here I'll be drawing outline of one cell so that you can appreciate that entire cell, and you can see there are 1, 2, 3 and 4 nucleus. Similarly, again I'll outline one cell and you can see how many nucleus are seen. I won't be drawing over the nucleus because I want you to appreciate the nucleus. Similarly here there are multiple nucleus. So this field shows multiple multinucleated giant cells. See here, this is a multinucleated giant cell. So you can see these in the lesion. Again, this is a different case, but it also shows multiple multinucleated giant cells. This is how it looks. That is a cellular outline, and these are the multinucleated giant cells. Actually, there are many. So these are multinucleated giant cells. What are they? They are multiple fused epithelioid, also known as activated macrophages. So what are the type of granuloma? So based on the T cell mediated response, they can be classified into foreign body granuloma and immune granuloma. So foreign body granuloma has the absence of T cell mediated response, and immune granuloma has T cell mediated response. So here you can see foreign body granuloma is because of any foreign material that you can see in the body. So these giant cells will try to contain the foreign body inside them, such as talc, suture material. So all of these trigger foreign body giant cell reaction and foreign body granuloma, whereas immune granulomas is because of T cell mediated response, because of might be a microbe. It is usually Th1 response, and they release enzymes such as interferon gamma, and then they cause response. Sometimes you can also see Th2 response in schistosomiasis. So this is the type of granuloma that you see, foreign body and immune granulomas, followed by these are either based on the necrosis that is seen, which is known as caseous necrosis. You can classify the granulomas into caseating granulomas and non-caseating granulomas. So these are the cases where you can see caseating granuloma. The first one is tuberculosis, and non-caseating is leprosy, syphilis, cat scratch, sarcoid, and Crohn's disease. So in tuberculosis, what do you see? You see caseating granuloma with caseating necrosis in the center. Then we have epithelioid cells, Langhans giant cells. So this is what they form. In leprosy, we have non-caseating granulomas with acid-fast bacilli. So lepra will be positive here, acid-fast bacilli positive. And here in syphilis, what do we see? There are more plasma cells. Plasma cell infiltrator seen. And the granuloma seen in cat scratch disease is known as stellate granuloma, which contains predominantly neutrophils. Right. So this is all that we require. These are the cases, causes of granuloma, and the types of granuloma. So now coming to the most common cause that we encounter in practice for granuloma is Mycobacterium tuberculosis. So it is covered, the membrane has mycolic acid, which leads to the acid fast positivity. Acid fast. So again, in chronic lung disease such as tuberculosis, there is increased risk of silicosis. So this is again an MCQ. Chronic lung disease like TB, you have an increased risk of silicosis. After this, coming to the pathogenesis. So this is a bit important. I would like you to remember this, because from here is what the INI question of 2023 November had come. So let's star mark it. So how do Mycobacterium tuberculosis? They enter into the macrophage via phagocytosis, and they use two receptors, which is mannose binding protein and type 3 complement receptor. They enter by using mannose binding protein and type 3 receptor, type 3 complement receptor. After that, so what does Mycobacterium tuberculosis do? It inhibits the lysosome, and it inhibits the phagolysosome formation by what? By choronin. So this is important. Coronin is activated, and this coronin activates the phosphatase calcineurin, which cause inhibition of phagolysosome. So phagolysosome inhibition will lead to proliferation of Mycobacterium tuberculosis, and it also inhibits calcium signals. So this is one thing that you have to remember. Coronin. So this host protein blocks the phagolysosome formation by recruiting a host protein, and this host protein is known as coronin. After that, the lipoproteins and glycolipids of Mycobacterium tuberculosis are recognized by toll-like receptors. For example, arabinomannan is recognized by TLR2, toll-like receptor 2. So here this might be a question, and this might be TLR2 might be a question. Again, so what kind of a response is tuberculosis? It's a type 1 helper T cell response. So when this happens, it stimulates the toll-like receptor 2, which produces interleukin 12 by the dendritic cell. So interleukin 12 is produced, and this T helper 1 response will lead to T helper 1 cells producing interferon gamma. So this was the INI 2023 question, interferon gamma. What does interferon gamma do? So interferon gamma causes maturation of phagolysosome. It activates nitric oxide synthetase, which produces nitric oxide. It produces defensins and causes autophagy of the damaged organelles. However, this interferon gamma is the reason why we have activated macrophages. So the question was, they showed a giant cell, and then they asked what is the cytokine which causes giant cells. So what do we say? The answer is interferon gamma, because interferon gamma activates the macrophages to form epithelioid cells, and those epithelioid cells, when they fuse together, they form multinucleated giant cells. So again, like I explained before, you can see here there are multiple giant cells, and let's revise the topic again. These multiple giant cells are formed by fusion of epithelioid cells, and these epithelioid cells are activated by interferon gamma. So this was the question. I hope you remember interferon gamma from here. And so now coming to the last slide, I hope you can identify here. So if you can see the collection of epithelioid histiocytes, a giant cell here. So this was a granuloma. It was a granuloma with multinucleated giant cells. So take home points from this slide was, first one is interferon gamma, coronin, Th1 response, which also leads to interleukin 12. I hope you understand. If there are any doubts, please get back to me and give me your feedback on this. Thank you.